Hello, I'm Jessica Aubert, and I am the Women's Health Physical Therapist at Bay Area Medical Center. I have worked at Bay Area Medical Center since 2006, and I took my additional training to treat pelvic floor disorders or problems more common to women, such as urinary incontinence, in the fall of 2006. What you can expect at a physical therapy evaluation for incontinence is a very thorough 90-minute examination the first day. Also, prior to that first day, I do mail you a packet of information that asks some questions just about how your bladder and bowels are working, how long it's been a problem, what things seem to aggravate or potentially alleviate it, and it includes a 2-day log where you track what you're eating and drinking, what times you're going to the bathroom, and when leakage is occurring, both times of day and what might be causing it. That just helps me to put together all the pieces from the history. Then, after reviewing that packet with you and going through some other general history questions, we proceed on to the actual examination. And that first includes a screen of your lower back and your hips, just to make sure none of the muscles in those areas are contributed to the problem with your pelvic floor muscles. But our main focus of the day is the pelvic floor muscles. If you've ever had physical therapy before, you know that we're muscle and bone people and how those areas work together. And the pelvic floor muscles are muscles just like anywhere else in your body, like the muscles of your legs and arms. We call those skeletal muscles. They help you with movement. And so this pelvis shows you where those muscles are. This would be where your spine comes up here. This is the sockets for the hip, and the pelvis makes a ring. At the bottom of that ring, if I just tilt this pelvis like the model is lying on their back, you can see a bunch of pinkish orange color, and that is all the pelvic floor muscles. The pelvic floor muscles are divided into 2 layers. There's a layer that's just underneath the skin, which is visible, and then if I tilt the model the other way, there are muscles that are deeper inside the pelvis. So my examination of these muscles includes, with your consent, feeling the muscles through the skin to make sure that there's not an area of spasm, or if you've previously had like an episiotomy or tearing with a birth, if there's scar tissue, how that tissue is moving. And then I do also do a vaginal assessment, and that lets me know what these deeper muscles are doing because they cannot be felt from the skin level. And when I do that, if you've ever heard of a Kegel contraction, that's what I'm testing. I want to know how tight your Kegel squeezes around my finger and how long you can hold that for, and how many repetitions of that contraction you can do to get an idea of strength and endurance of the pelvic floor muscles. I do also palpate or feel all of the muscles on that deeper layer vaginally as well. If you're having any trouble with fecal or incontinence of stool, then sometimes we also do a rectal exam, which is very similar to the vaginal exam, just done rectally. And once we have all that information, then I can put together a program to help strengthen your muscles, help stretch or relax your muscles. And then with that bladder diary, we can look at your voiding and see if we need to do any treatment for that. Women's Health Physical Therapy is a subspecialty of physical therapy where we focus on conditions that are more common to women, and that can be anything throughout the female lifespan. So, for example, in the teenage years to early adulthood, when women are more active and their bodies are changing because they're still growing, they are more prone to ACL injuries of the knee. So it can start with common orthopedic things that people think of when they think about physical therapy, but then it can get into more specialized things for women like urinary and fecal incontinence, pelvic pain, and pelvic pain can be from a wide variety of reasons. That can be pain during or after pregnancy. It can be from conditions that are common to women like endometriosis that can lead to scarring. It can be after a pelvic surgery. There's many things that can cause pelvic pain. And then also lymphedema, which is not just something that happens to women, but can happen after breast cancer. It is typically from cancer treatment, whether radiation, chemo, or actually having to have lymph nodes removed, and that causes swelling in an arm or leg depending on where those lymph nodes are located. So that's another thing that a women's health physical therapist could treat. Someone would know if they would benefit from physical therapy to treat their incontinence by, one, just talk to your doctor about it. But if you are having leakage that you cannot control and that's bothersome to you, then likely you would benefit from some sort of treatment. And physical therapy is definitely one of the things on the conservative realm of treatments that should be tried in the beginning of the process to get rid of the leakage, sort of like medications, things that you would try before you went to something like a surgery. But the main thing is to make sure other things are ruled out. A bladder infection, for example, can lead to urinary incontinence, and that's definitely something that physical therapy is not going to help with. That just takes an antibiotic. So the most important thing is to talk to your doctor about your leakage so that they can direct you on the correct path of treatment so that you don't have to live with it.